I am Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to recap and talk to you about this exciting new neuropathy program that we're starting in our practice the week of July 10th. If you know somebody who's suffering with pain and the associated symptoms with neuropathy, you're not going to want to miss this one, so stay tuned. Okay, Dr. Mike, we've been talking for a long time now about treatment options for neuropathy. We talked about the regenerative medicine approach. We're really excited about this new program that we're going to be starting in our practice next week with Neurogenx. This is a protocol that can really help patients that are suffering from the pain associated with neuropathy.
Without question, and the thought process is that it's something innovative, a little different. We know for many years there's really not a lot of treatment for neuropathy. And the question is, how do we get people to feel better? And the key here is not just pain of neuropathy, which is a common problem. The symptoms of neuropathy cover a lot of things, but the functionality, or I should say the loss of function, losing balance and losing the ability to be protective of your feet and standing position, and all these things that kind of throw off the person's function, can also potentially be improved when we start thinking about this new treatment.
Yeah, and we're so excited about it too because again, we've never really had an option that not only helps with the symptoms, but on the physiological side, we're actually seeing some great studies and research about the increase in the density of the nerve fiber. So we're actually really addressing the root cause of the patient's problem.
That's true, and the way that the studies are showing is that there's not only just a loss of density of the nerve fibers, but the blood supply to the nerve and the sheath of the nerve and the way the nerve functions. Is there little dynamics between how do you get nutrition through the blood supply to the nerves, and then how does that nerve regrow or kind of stay vibrant? And so this system tries to help looking at a little bit of both, the vascular, the microvasculature component of things, and those little tiny small nerve endings of what we all rely on. So that combination of vessels, blood supply, nerve issues, nerve pain, all this stuff, all comes together. We're going to approach it all.
Yeah, and it really comes down to three components where we have a diagnostic test that confirms that diagnosis of neuropathy, and then the treatment itself. So a little bit of a summary about the treatment. We kind of have a nerve block set up for the lower extremities, and that nerve block is really set up so that the patient actually can go through the treatment, which is about 20 to 25 minutes of a high intensity electric stimulation where the pads are placed on the lower legs. They go through the treatment, and over the course of time, and it looks like it's about a 12-week program, that we start to see a significant reduction in the patient's symptoms. And statistically, they're talking about 87% overall improvement with the patients that have gone through this protocol.
And that's the key, is that there's a precedent in some of the research and nerve problems of other areas. And so the spine, for instance, as we're very familiar with having a pinched nerve and a sciatica and a long-term aspects of the nerve not functioning well to the leg. Well, electrical stimulation has been used and starting to be researched more and more and more to help that person to kind of reduce the pain fibers and the input that that nerve causes a person's perception of pain. Well, the same similarity kind of comes into play when your nerve is dying or having problems in the periphery, down at your foot. So the electrical stimulation is the way which we take that charge of electrical impulses and suppress some of these pain fibers. And then in this combination of looking at the microvasculature, the nerve stimulation with the nerve block, we can really get to the root cause of the aspects of the nerve damage and regenerate some of those small nerve fibers to improve a person from their foot up.
Yeah, and it's wonderful too. Most insurances are going to be covering this treatment too. And if you or a loved one, or if you know somebody that's suffering from the symptoms associated with neuropathy, you definitely want to give us a call. More information can always be found on our website, which is listed below, maragalmedical.com. And certainly check out our YouTube page. We're constantly updating all of that patient information, and please subscribe. We want to get close to that 1,000 subscription. Well, that's it from today. I hope you learned something, and I hope more importantly, you're excited about this new neuropathy program that we have here at Maragal Medical.
See you soon.